At the same time, most patients, it is accompanied by vomiting. So you actually cannot help yourself. You will be dehydrating from diarrhea, and you're not able to rehydrate by mouth. And that is what makes cholera so dangerous. Not everybody has vomiting, and in such cases, oral rehydration therapy may ameliorate your symptoms until you can reach a medical facility. Of course, with active dehydration, you become very unwell, you become fatigued, you may or may not have fever. Of course, with the diarrhea, you have severe abdominal cramps. And if you dehydrate very quickly, then you will be in a state of collapse. With oral rehydration therapy, it gives us a little bit of respite before you can present yourself to hospital. Oral rehydration therapy is available in all pharmacies. You can actually make it yourself with clean water, a little bit of sugar, and a little bit of salt, according to a fixed formula that is available online. And it is advised that if you start to develop symptoms of diarrhea and vomiting, that you start treating yourself with oral rehydration therapy, either that you make yourself or that you buy in a pharmacy before you present yourself to our medical facilities. Of curbing the spread of a dangerous pathogen is to offer treatment absolutely free of charge of any suspected case in our government hospitals. That makes sure that we can attract patients to our facilities without them worrying that they have to pay. It allows us to remove from community patients who are infected. Thereby, we're able to slow down the transmission and bring an end to an outbreak. Control with an incident command structure led by His Excellency the Governor, Mr. Babajide Sanwo-Olu, the Deputy Incident Commander, who is the Commissioner of Health, myself, and then the Emergency Operations Center, which is managed in the Ministry of Health with multiple pillars representing different ministries, agencies, private sector. We do not just wait for patients to come to our facilities. We go out and actively search for them. If you present yourself to hospital, it is likely that you have been in contact with members of your family, friends, and colleagues at work, and therefore we trace each and every one of the persons that have been in contact with you to identify if they have actually contracted the pathogen. In this case, cholera is a contagious, waterborne, foodborne contact bacteria. So it is easily spread if you have the pathogen on your hands, or you've been in contact with somebody that has it, or you've consumed food or water that contains the pathogen. The next slide demonstrates the typical features and symptoms of cholera. The topmost symptoms are prophylaxis. As you can see, we started to notice cases on the 5th of June. A few cases in our government facilities. It started to rise very gradually to 14 on the 8th and 35 on the 9th. But on the 10th of June, we saw an unprecedented number of cases in our government facilities, predominantly around Lagos Island, Lekki, and Koshofe. This triggered a situation for us, and we activated our Emergency Operations Center. We informed Mr. Governor, the Incident Commander, that we suspect that we're dealing with an outbreak of a severe gastroenteritis, and until proven, we assumed it was cholera associated with the Ilea period, which was to be expected. Immediately after the Ilea period, our children was supposed to go back to school. Again, we intensified our activity to make sure that our schools were on high alert. We did not want to cancel either the festive period or the resumption of our schools in Lagos. And as you can see, we had a slight increase around the 18th, 19th, and 20th, 21st, but as of the 22nd, the numbers have started to come down. And as yesterday, we had, I think, just 1 or 2 cases reported. We're yet to clean up the data from yesterday. But the general trend is that the numbers have significantly reduced, and we're not seeing the numbers of cases as we did before. The next slide just repeats this information in graphic detail. Active case searching, our numbers started to decline on the 11th, on the 12th, 13th, 14th, and 15th. Being cognizant of the festive season around Ilea, we actually quadrupled our intensive case searching around the community to make sure that we could stop a massive resurgence during the festive season of Ilea, being such an important festive period for us in Lagos. We did this indeed, and as you can see with the blue arrow there, that blue arrow marks our intensification of case searching, active rapid response activity in the community, going out to look for people who may or may not have experienced diarrhea and vomiting, patient contacts, identifying them, just so that we could interrupt the transmission of cholera during the festive season. I think our intensification of identifying of cases resulted in a slight increase in the numbers that we identified since the resumption after the break. The next slide just shows you a graphic representation of the intensity of the cases around Lagos, and you can see there in red were the predominant cases where we had the heaviest burden of cholera in Lagos Island, Lagos Mainland, and Koshofe. The next slide just gives you a graphic representation of the intensity and burden of cholera across our local governments, with the highest number in Lagos Island, followed by Koshofe, Lagos Mainland, Etiosa, Alimosho, and the lowest impacted were Ifako-Jaye, Amuodofin, and Ibejule. The next slide shows you the distribution of individuals that succumbed to cholera in terms of were confirmed either clinically or by laboratory diagnosis. It gives you an idea of what we do in the Emergency Operations Center. The Emergency Operations Center adopts the One Health paradigm. In other words, we do not work in isolation. We work in concert with multiple agencies and ministries, in particular the Ministry of Environment and Water Resources, the Ministry of Education, positioned cholera kits in all our hospitals and private hospitals. We've been able to distribute oral rehydration solutions widely, and as you can have observed, we've intensified risk communication, public awareness information, interviews on radios, televisions, social media, to make sure that Lagosians are aware. Environmental Health and the Lagos State Environmental Protection Agency are actively collecting samples of water, food, and beverages at multiple sources. So far, we have not been able to identify a source yet, but the investigations are continuing because we want to see if we can identify a particular source or sources. But moving forward, we're going to keep active surveillance around our water sources and the distribution of beverages in Lagos State. Mr. Governor, incidentally, has just approved an initiative called Safe Plate, which we were about to launch about 3 weeks ago, just before the cholera outbreak, to ensure that we can intensify food safety practices in Lagos, which covers potable water, beverage consumption, and food, and of course, those persons that manage water, food, and beverages in terms of food handlers and the tests and surveillance that needs to accompany them to ensure that we do not have incidents of foodborne disease increasing in Lagos State. Wash raw fruits and vegetables thoroughly, cook food properly, thoroughly reheat and any leftover food before consuming. Avoid unregulated and unregistered street beverage vendors. When you buy a beverage on the street, check that it has a NAFDAC number on it. If it doesn't have a NAFDAC number on it, then it is not a registered manufacturer of a beverage and it should be avoided. Please keep your general environment clean and sanitized. Thank you for your attention.